The heat inside the tent was suffocating, 112 degrees outside, but the surgical unit felt hotter, thick with the smell of antiseptic and sweat, and something metallic that never quite washed out. The fabric walls trembled every time a Humvee rolled past, dust filtering through the seams, settling on everything. Commander Jack Reese stood at the head of the makeshift briefing table, arms crossed, jaw set. He was 48, square-shouldered, with the kind of face that looked like it had been carved out of something harder than bone. 25 years in the Navy, 2 combat deployments, a record so clean it could have been laminated. He looked at the woman standing across from him and saw a problem. Lieutenant Commander Sarah Lindgren, 32, blonde hair pulled into a bun so tight it looked painful, pale blue eyes that didn't blink enough. She stood with her hands clasped behind her back, shoulders square. But there was something in the way she held herself that Reese didn't like. Too still, too calm, like she was waiting for something to go wrong. "I don't care what you did in Kandahar," Reese said. His voice was flat, controlled. "Here, you follow my protocol, my OR, my rules. You don't freelance, you don't improvise, you don't make calls above your pay grade. Are we clear?" Lindgren didn't flinch. "Crystal clear, sir." "Good." He turned to the rest of the staff. 3 surgeons, 2 anesthesiologists, a handful of corpsmen clustered around the table. "This is a forward surgical team, not a teaching hospital. We run lean, we run fast, and we don't take risks we can't afford. Lieutenant Commander Lindgren is here on assignment. She'll handle minor traumas, stabilizations, post-op monitoring. Nothing critical until I say otherwise." One of the younger surgeons, a captain named Booker, glanced at Lindgren, then back at Reese. "Sir, her file says she did 2 tours in Afghanistan, thoracic and vascular trauma. Shouldn't she be—" "I've read her file," Reese cut him off. "That's why she's here." The room went quiet. Lindgren's expression didn't change. She just nodded once, a single dip of her chin, and turned toward the door. "Dismissed," Reese said. She walked out into the blinding afternoon light, boots crunching on the gravel. The base was a grid of tents and Connex containers, ringed by HESCO barriers and concertina wire. Fallujah sprawled beyond the perimeter, a city made of dust and ruin. Smoke rose in thin columns from the east. Mortars had hit that morning. They'd hit yesterday, too. They'd hit tomorrow. Lindgren pulled a canteen from her belt, took a long drink, and scanned the camp. She'd been in country for 4 days, long enough to know the layout, long enough to hear the whispers. "That's her, the one from Kandahar. Heard she got reprimanded. Unauthorized transfusion. Gave her own blood in the field. Lucky she didn't kill him." She screwed the cap back on the canteen and kept walking. The aid station was a long tent divided by hanging plastic sheets. 6 cots on one side, a makeshift triage area on the other. Lindgren stepped inside, letting her eyes adjust to the dimness. A corpsman was restocking a supply cart near the back. Young, maybe 23, with dark hair and sharp eyes. His name tape read Navarro. He looked up when she entered. "Ma'am." Lindgren nodded. "Anything coming in?" "Not yet. Quiet morning." He paused, then added, "Relatively." She almost smiled. Relatively. Navarro went back to his work, sorting gauze packs and IV kits with the kind of precision that came from repetition. Lindgren moved to the sink, scrubbed her hands even though she hadn't touched anything yet. Muscle memory. The water was lukewarm, recycled, smelling faintly of chlorine. "You're the new surgeon," Navarro said. "Not a question." "That's right. Heard you were in Kandahar." Lindgren didn't answer right away. She dried her hands on a towel that had been white once, now gray with use. "I was." Navarro glanced at her, then back at the cart. "Must have been rough." It was. He didn't push. That was something she appreciated. Most people wanted the story, wanted the drama, wanted to know what it felt like to cut someone open under fire. Navarro just kept working. The radio on his belt crackled. "Aid station. This is gate 3. We've got 1 incoming. Walking wounded. Shrapnel, right shoulder. ETA 2 minutes." Navarro grabbed the handset. "Copy that. We're ready." Lindgren moved to the triage table, pulling on gloves. Navarro handed her a pair of scissors, a pack of gauze, a bottle of saline. He didn't ask if she needed them. He just knew. The Marine came in on foot, supported by another soldier. Early 20s, maybe younger, face streaked with dust and sweat. His right shoulder was wrapped in a field dressing, already soaked through with blood. He was pale, breathing fast, but his eyes were focused. "Sit," Lindgren said, gesturing to the cot. "Let me see it." The Marine sat. She cut away the dressing, peeled back the fabric. The wound was ragged, maybe 3 inches long, deep enough to see muscle, shrapnel still embedded. She could see the edge of it, dark metal against red tissue. "How long ago?" she asked. 30 minutes, maybe 40. "Any numbness? Tingling?" "No, ma'am." She irrigated the wound with saline, wiped away the blood. The shrapnel was lodged near the deltoid, close to the axillary nerve. Not life-threatening, but it needed to come out clean. One wrong move, and he'd lose motor function. Navarro stood beside her, watching. She didn't ask for instruments. She just held out her hand, and he placed a pair of forceps in her palm. She worked quickly, no hesitation. Fingers steady, movements economical. She grasped the fragment, applied traction, felt the resistance, adjusted the angle. It came free in one smooth pull. She dropped it into a metal tray, the sound sharp and final. "Pressure," she said. Navarro handed her gauze, and she packed the wound, applied a fresh dressing, wrapped it tight. The Marine exhaled. "Thanks, Doc. Keep it clean. Change the dressing twice a day. If you get a fever, come back immediately." "Yes, ma'am." He stood, tested his arm, nodded, and walked out. Navarro picked up the tray, looked at the fragment. That was fast. Lindgren stripped off her gloves. It wasn't complicated. Still, he held up the forceps. "You didn't ask for these. You just knew I'd hand them to you." She met his eyes. "You did, didn't you?" He smiled, just a little. "Yeah, I did." "Before we begin, tell us where you're watching from. And if you want to support the channel, please subscribe and hit the like button on this video, because what Dr. Lindgren does in the OR today will rewrite the rulebook and save a life no one else could. The next morning came with the sound of rotors. A Black Hawk touched down beyond the perimeter, kicking up dust that turned the sky brown. Lindgren was already awake. She'd been awake since 0400. Running the perimeter in the pre-dawn dark, trying to outrun the heat before it became unbearable. She showered in a stall that smelled like mildew, dressed in fresh DCUs, and walked to the mess tent. Coffee that tasted like burnt metal, eggs that came from a powder. She ate alone at the far end of a long table, watching the other surgeons talk in low voices near the front. Captain Booker leaned toward another surgeon, a lieutenant named Hayes. His voice carried just enough. "You hear what happened in Kandahar?" Hayes shook his head. "Unauthorized field transfusion." She hooked herself up to a Marine, gave him her own blood. No tight match, no pros, nothing. Guy lived, but she got written up for it. Jesus. Reese thinks she's reckless. That's why she's here. Observation only. Lindgren kept eating. She didn't look up, didn't react. She'd heard worse. Navarro slid into the seat across from her, tray in hand. "Morning, ma'am." "Morning." He took a bite of toast, glanced toward the other table. "They always talk this much?" "Usually." "You gonna say anything?" "No." He nodded, chewing slowly. "Fair enough." They finished in silence. Outside, the heat was already building. 108 by 0800. The flag hung limp on its pole. Lindgren walked to the surgical tent. Reese was inside, reviewing a chart with Hayes. He looked up when she entered. "Lieutenant Commander." "Sir." "You're on post-op monitoring today. Bed 3 needs a dressing change. Bed 5 needs vitals every hour. Bed 6 is being prepped for evac this afternoon. Make sure he's stable." "Understood." Reese handed her the chart. And Lindgren, "Sir, stay in your lane." She took the chart. "Always do, sir." He held her gaze for a moment, then turned back to Hayes. Lindgren moved to bed 3, a Marine, mid-20s, recovering from an appendectomy. Routine case. She checked the incision, changed the dressing, noted the absence of infection. Vitals stable, temperature normal. Bed 5, another Marine. Shrapnel removal from the thigh. Healing well. She logged his blood pressure, pulse, respiratory rate. Everything within range. Bed 6, a sergeant, maybe 30, with a through-and-through gunshot wound to the abdomen. Surgery 2 days ago. She read the notes. Damage control laparotomy, colon repair, no complications listed. She pulled back the sheet, examined the dressing. It was clean, no drainage, but something felt wrong. She pressed gently on his abdomen. He winced. "That hurt?" she asked. "A little." Been achy since yesterday. She palpated the lower quadrants, firm, slightly distended. She checked his chart again. Last bowel movement, none since surgery. When did you last pass gas? I don't know. Maybe yesterday morning? She looked at his eyes, slightly pale. She checked his pulse, elevated, temp, 99.2. Not high, but higher than it should be. She leaned closer, pressed again. He hissed through his teeth. Navarro was restocking a cabinet nearby. She turned to him. Get me an ultrasound, portable unit. He grabbed it without asking why. She powered it on, applied gel to the sergeant's abdomen, and ran the transducer across his lower quadrants. The screen flickered. Loops of bowel, sluggish, distended. Free fluid pooling near the surgical site. Her jaw tightened. She set the probe down, pulled off her gloves. Navarro was watching her. What is it? He asked quietly. Missed perforation, small bowel. Probably happened during the initial surgery. It's leaking. Navarro's eyes widened. He's septic? Not yet, but he will be. She grabbed the chart, walked straight to Reese. He was still talking to Hayes. Sir, I need a word. Reese looked up, irritated. I'm in the middle of something. Bed 6, Sergeant Macklin. In post-op day 2 from a laparotomy, he's got free fluid, distended bowel, low-grade fever, and rebound tenderness. I think there's a missed perforation. Reese frowned. I reviewed that case myself. The repair was clean. With respect, sir, something was missed. He took the chart, scanned it. Vitals are stable. Temps barely elevated. You're overreacting. Sir, if we wait, he'll go septic. He needs to go back to the OR now. Reese closed the chart, handed it back to her. He's scheduled for evac in 4 hours. We'll let the surgical hospital handle it. He won't make it 4 hours. That's not your call, Lieutenant Commander. She held his gaze. Sir, I'm telling you. And I'm telling you to stay in your lane. He turned back to Hayes, dismissing her. Lindgren stood there for a moment. Then she walked back to bed 6. Navarro was still there. What did he say? He said no. Navarro looked at the sergeant, then back at her. So what do we do? She checked the sergeant's vitals again. Pulse climbing. Temp up to 99.4. We monitor him, closely. And if he crashes, we move fast. 2 hours later, the sergeant spiked a fever. 102. Pulse, 120. Blood pressure dropping. Navarro found her in the supply tent. Ma'am, Macklin's crashing. She was already moving. Reese was in the OR with another case. She didn't wait for permission. She wheeled the sergeant into the surgical bay, prepped him herself. Gloved up, Navarro stood across from her. You sure about this? He asked. No choice. She made the incision along the previous scar line, extended it, opened the abdomen. Bowels spilled into view, inflamed, leaking stool from a pinhole perforation near the anastomosis. She clamped it, resected the damaged section, reanastomosed with interrupted sutures, irrigated the abdomen with 4 liters of saline. 40 minutes, start to finish. When Reese walked in, she was closing. He stared. What the hell is this? Missed perforation, she said, not looking up. He was going septic. I didn't have time to wait. Reese's jaw worked. I told you he was stable. He wasn't. She tied off the last suture, stepped back. Navarro covered the wound with a dressing. Reese pulled off his mask. You just disobeyed a direct order. I saved his life. That's not the point. She met his eyes. Then what is? Reese didn't answer. He turned and walked out. Navarro exhaled. That was intense. Lindgren stripped off her gloves. That was necessary. The sergeant stabilized. Temp down, pressure up. By evening, he was awake, groggy but alive. Reese didn't say another word to her that day. But Navarro did. Where did you learn to move that fast? He asked quietly, as they restocked the surgical trays. She didn't look at him. Experience. He nodded slowly. That wasn't just experience. That was something else. She didn't answer, but he kept watching her. And he kept wondering. The radio crackled at 0230. Everyone was asleep except the watch. Lindgren was in her rack, eyes closed but not sleeping. She never really slept, not here. Mass casualty, incoming. Mortar strike on patrol base Jolan. 9 wounded. 4 critical. ETA 12 minutes. She was on her feet before the announcement finished. Boots laced in 15 seconds. Hands scrubbed in 30. The surgical tent was already lighting up. Fluorescent glare cutting through the dark. Reese came in pulling on his gloves. Booker and Hayes right behind him. Navarro and 2 other corpsmen prepped the tables. laying out instrument trays, hanging IV bags, checking the suction. Lindgren moved to the third table without being told. Reese glanced at her but didn't say anything. No time. The Humvees came in fast, headlights bouncing over the uneven ground. Dust everywhere, shouting. The wounded were carried in on stretchers, some walking, some not. Lindgren took one look at the triage board. 3 red tags, 6 yellow. Reese pointed. Booker, take the head trauma. Hayes, sucking chest wound. Lindgren, you've got the abdominal GSW, the femur fracture. And the shrapnel case, stabilize and reassess. She didn't argue, she just moved. The first patient hit her table. Marine, 22, gunshot wound to the lower abdomen. Entry wound left flank, no exit. Conscious but pale, pressure already dropping. Navarro was beside her. BP 80/50, pulse 135, 2 liters in. She cut away the uniform, exposed the wound. Small entry, no active bleeding externally, but his belly was rigid, intra-abdominal hemorrhage. Get me 4 units ONEG and prep the OR. We're opening him now. Navarro moved fast. She intubated the patient herself, pushed the drugs, waited for the breath sounds to equalize. Then she draped, prepped, and cut. Midline laparotomy. She opened the abdomen in one smooth incision. Blood welled up, dark and fast. She suctioned, packed all 4 quadrants with lap pads, and started the search. Liver lac, grade 3. Bleeding from the right lobe, she clamped the hepatic artery. Packed the liver, moved on. Bowel looks intact, spleens fine, kidneys okay. She irrigated, suctioned, checked again. The liver was the source. She placed a running suture along the laceration, tied it off, released the clamp. The bleeding slowed, then stopped. She closed the abdomen in layers. 18 minutes. Navarro stared. Ma'am, that was... Next patient. The second one rolled in. Femur fracture, open, bone protruding through the thigh. Bleeding controlled in the field. But the leg was mangled. She realigned the bone, placed an external fixator, debrided the wound, packed it with antibiotic-soaked gauze. 13 minutes. Third patient. Shrapnel to the chest and shoulder. She removed 3 fragments, repaired a small pneumothorax with a chest tube, sutured the shoulder. 11 minutes. By the time she stepped back, 42 minutes had passed. 3 patients stabilized, all alive. Reese was still working on his case. Booker too. Hayes had just finished. Lindgren stripped off her gloves, washed her hands, and checked the board. 2 more yellows waiting. She took them both. When the last suture was tied, the sun was coming up. The tent was quiet, except for the hum of monitors and the hiss of ventilators. Reese stood near the door, arms crossed, watching her. She walked past him to the sink. He didn't say anything at first. Then, quietly, "How many surgeries have you done under fire?" She dried her hands. "Enough." That's not an answer. She turned to face him. In Kandahar, we averaged 12 trauma cases a day, minimum, sometimes 20. We didn't have time for lengthy procedures. We didn't have backup. We did damage control and moved on. That's the answer. Reese studied her. You handled 3 at once. They needed it. Most surgeons can't do that. Then most surgeons haven't been where I've been. He held her gaze for a long moment. Then he nodded, once, and walked out. Navarro approached, holding a tray of instruments. "Ma'am, I've been doing this for 2 years. I've seen a lot of surgeons." He set the tray down. "I've never seen anyone move like that." She didn't respond. "Indeed, that liver repair. You didn't even hesitate. You went straight to it like you'd done it 1,000 times. I have." He looked at her. "Where?" She glanced at him, then back at the empty OR. "Kandahar. Helmand Province. Sangin. Places where if you didn't move fast, they died. So you moved fast." Navarro nodded slowly. "That's why Reese keeps you on a leash." She almost smiled. "Probably." He picked up the tray. "For what it's worth, ma'am, I'd want you on my table any day." She met his eyes. "Appreciate that, Navarro." He left. She stood there for a moment, alone in the empty tent. The light outside was orange now, the heat already building. Another day in Fallujah. She walked outside. Reese was standing near the HESCO barrier, smoking a cigarette. He didn't smoke often. She'd only seen him do it twice. He saw her and nodded. "Acceptable work, Lieutenant Commander." She stopped a few feet away. Just acceptable? He exhaled smoke, looked at her. You saved 3 lives tonight. That's more than acceptable. But it doesn't change what happened in Kandahar. What happened in Kandahar saved a life too. Against protocol. Protocol would have let him die. Maybe. He flicked ash onto the ground. Or maybe you just got lucky. She didn't answer. There was nothing to say. Reese dropped the cigarette, crushed it under his boot. You're skilled, I'll give you that. But skill without discipline is dangerous. Is that what you think I am? Dangerous? He looked at her. I think you're someone who believes the rules don't apply to her. And in a place like this, that's the most dangerous thing there is. He walked away. Lindgren stood there, watching the sun rise over the broken city. The smoke columns were already climbing into the sky. She didn't feel dangerous. She just felt tired. But somewhere deep down, in a place she didn't like to visit, she knew Reese was right. She didn't follow the rules. She followed the patient. And sometimes, that was the same thing as breaking everything. She turned and walked back to her tent. Navarro was waiting outside, holding a canteen. Thought you might need this. She took it. Thanks. He hesitated. Nam, can I ask you something? Go ahead. Why do you do it? Push so hard, I mean. You don't have to. You could just do your job and go home. She took a drink, handed the canteen back. Because if I don't, someone dies. And I can't live with that. He nodded. Yeah, I get that. She looked at him. You do, don't you? He smiled faintly. That's why I'm still here. She almost smiled back. Almost. 3 days passed. The base settled into a rhythm. Patrols went out. Some came back. The surgical tent ran 12-hour shifts. Lindgren worked most of them. She didn't sleep much, didn't talk much, just worked. Reese kept his distance. He assigned her cases, watched from across the tent, said nothing. But his eyes followed her, calculating, measuring. Navarro noticed. So did the others. On the 4th day, Captain Booker approached her in the mess tent. She was eating alone again. Same table, same spot. He sat down across from her. Mind if I join you? She looked up. Free country. He smiled, but it didn't reach his eyes. I wanted to say what you did the other night, with those 3 Marines. That was impressive. Thank you. Where'd you train? Johns Hopkins, right? That's right. He nodded, stirring his coffee. I did my residency at Mass General. Thought I was hot stuff. Then I got here. He looked at her. You don't seem rattled by any of this. I've done it before, Kandahar. She didn't answer. He leaned forward slightly. Look, I know Reese has you on a short leash, and I know why. But for what it's worth, I think you're wasted on post-op duty. I go where I'm told. Yeah. He stood, picked up his tray. But if it were up to me, you'd be running this place. He walked away before she could respond. She finished her meal in silence. That afternoon, Lindgren was in the supply tent, restocking suture kits when the alarm went off. Not the standard radio chatter. This was different. Louder, sharper. Mass casualty alert. IED strike on convoy route Michigan. 12 casualties inbound. 4 critical. Multiple traumatic amputations. ETA 8 minutes. All personnel to trauma bay. Repeat. All personnel to trauma bay. She dropped the suture kit and ran. The tent filled fast. Reese was already there, barking orders. Booker and Hayes scrambled into position. Navarro and the corpsman laid out the tables, prepped the lines, checked the airway kits. Lindgren moved to the 3rd table. Reese saw her, hesitated, then nodded. You're taking the overflow. Stabilize and hold. Nothing heroic. Understood? The Humvees came in hard. Doors flew open. Stretchers everywhere. Blood on the ground before the patients even hit the tables. Reese took the first critical. Double amputation, both legs below the knee. Booker took the second. Sucking chest wound with flail chest. Hayes took the third. Traumatic brain injury with skull fracture. Lindgren's table filled fast. A Marine, mid-20s, right arm mangled from the elbow down. Conscious, screaming. Another Marine, shrapnel to the abdomen and legs. A third, burns across the chest and face. She triaged in seconds. Arm first. The bleeding was arterial. Navarro, tourniquet high and tight. Get me vascular clamps and 2 units ONEG. She cut away the sleeve. The brachial artery was severed. Bone fragments embedded in the tissue. She clamped the artery, debrided the wound. Ligated the vessel. The screaming stopped. The Marine passed out. Next, the shrapnel case. She opened the abdomen, found a liver lac and a perforated bowel. She packed the liver, resected the bowel, closed fast. 22 minutes. Next, the burn case. She debrided the necrotic tissue, placed a temporary dressing, started fluids. He'd need a burn unit, but he was stable. She stepped back. 3 patients, all alive, all stable. Across the tent, Reese was still working. Booker was closing. Hayes was struggling. Lindgren glanced at the triage board. 1 more red tag waiting. No table available. She moved to the corner, cleared a space, and brought the patient over herself. Marine, maybe 35, sergeant stripes on his sleeve. IED blast. Shrapnel to the chest, abdomen, and neck. Unconscious. Pulse thready. BP 60/40. She intubated him, got 2 lines in, started transfusing. Then she opened his chest. Hemothorax, massive. She placed a chest tube, drained 2 liters of blood, and kept going. His abdomen was rigid. She opened it. Splenic rupture, grade 5. No way to save it. She clamped the splenic artery, removed the spleen, packed the abdomen, and checked for other injuries. Liver intact, bowel intact, kidneys okay. She closed him in layers. 34 minutes. When she stepped back, the tent was quiet. All the patients were stabilized, all alive. Reese pulled off his gloves, looked around. His eyes landed on Lindgren, then on the sergeant on her table. He walked over. Who authorized you to take another critical? No one. There was no one else. I told you to stabilize and hold. I did. Then I took the next one. Reese stared at her. You don't get to make that call. Someone had to. He opened his mouth to respond, but a voice interrupted. Doc? They both turned. The sergeant was waking up. His eyes fluttered open, unfocused, confused. Lindgren moved to his side. You're okay. You're at the FST. You had surgery. You're stable. The sergeant blinked, looked at her. His voice was rough, barely a whisper. Kandahar. She froze. He squinted at her, recognition dawning slowly. You're the one. The transfusion. You gave your own blood to Corporal Jensen. The tent went silent. Everyone was listening now. Reese stepped closer. What? The sergeant's eyes stayed on Lindgren. I was there. I saw it. Jensen was dying. No blood left in stock. She hooked herself up to him, gave him 2 units. He lived. Reese turned to her. Is that true? Lindgren didn't answer. The sergeant coughed, winced. She saved his life. Got written up for it, but she saved his life. Reese's jaw tightened. He looked at Lindgren. My office. Now. She followed him out of the tent, into the blinding heat. He didn't stop until they were behind a Connex container, out of earshot. He turned on her. Is that true? Yes. You gave your own blood to a patient in the field. Yes. Without a tight match, without a cross, without authorization. There was no time. He was dying. That's not how this works. That's exactly how it works when there's no other option. Reese stepped closer. You could have killed him. You could have killed yourself. But I didn't. That's not the point. Then what is the point, Commander? The point is you don't get to decide when the rules apply. The point is you're reckless. The point is. The radio on his belt crackled. Commander Reese, we have an urgent incoming. Marine officer, Lieutenant Briggs. IED blast, shrapnel near the heart. He's coding. ETA, 4 minutes. Reese grabbed the radio. How unstable. Flight medic says he's been down twice already. They got him back, but he's circling. Severe hemorrhage. They don't think he'll survive the evac. Reese looked at Lindgren, then back at the radio. Bring him in. We'll stabilize and send him to the surgical hospital. He won't make it, Lindgren said. We'll do what we can. I can do this. No, Commander. That's an order, Lieutenant Commander. She held his gaze. Then court-martial me after. She turned and walked back to the tent. Reese stood there, fists clenched. Then he followed. The Black Hawk came in fast, rotors screaming, dust swirling in thick clouds that turned the air brown. Lindgren was already at the landing zone, Navarro beside her. The crew chief jumped out before the skids even touched down. He's crashing. We've shocked him twice. You've got maybe minutes. They pulled the stretcher out. Lieutenant Briggs, 29 years old, Marine platoon leader. His uniform was shredded, soaked through with blood. His face was gray, lips blue. The flight medic was doing compressions. Lindgren grabbed the rails. Straight to the OR. Move. A ran. The stretcher rattled over the uneven ground. Navarro called out vitals as they moved. No pulse. No pressure. Pupils fixed and dilated. Reese met them at the tent entrance. He took one look at Briggs and shook his head. He's gone. Not yet, Lindgren said. She's been down for 6 minutes. Then we have 6 minutes to get him back. Lieutenant Commander, we don't have the resources for this. We stabilize and evac. That's protocol. He won't survive the evac. You know that. Reese stepped in front of the stretcher. Rar, I'm ordering you to stand down. Lindgren met his eyes. With respect, sir, if you want to stop me, you're going to have to physically remove me from this tent. Silence. The whole team was watching now. Booker, Hayes, the corpsmen, everyone. Reese's jaw worked, then he stepped aside. Lindgren pushed the stretcher to the table. Navarro, get me a thoracotomy tray, 4 units ONEG, and a hypothermia protocol kit. Booker, I need you on airway. Hayes, get me vascular access, both arms. They moved, no questions. Reese stood near the door, arms crossed, face like stone. Lindgren scrubbed fast, gloved up, didn't wait for the drape. She picked up the scalpel and made a left lateral thoracotomy incision from sternum to spine. 1 long cut. Rib spreaders in. She cranked them open. The chest cavity was full of blood. She suctioned 2 liters, then 3. The heart was visible, barely moving, fluttering weakly. Pericardial tamponade, she said. There's a fragment lodged in the right ventricle. Navarro stared. How are you going to? Hypothermia protocol. We're dropping his core temp to buy time. She grabbed the IV line, pushed cold saline directly into the chest cavity. Then, she packed ice around the heart. The monitor flatlined. Booker looked up. He's gone. No, Lindgren said. He's suspended. We've got maybe 10 minutes before brain damage. She worked fast. Fingers inside the chest, she located the fragment, a jagged piece of shrapnel embedded deep in the ventricular wall. She couldn't just pull it out. The second she did, he'd exsanguinate. Navarro handed her a vascular clamp. She placed it proximal to the fragment, applied pressure, then grasped the metal with forceps. 1 pull. Clean. No hesitation. The fragment came free. Blood welled up immediately. She placed a pledgeted suture, tied it down, reinforced it with a second. The bleeding stopped. She released the clamp. The heart twitched. Once. Twice. Come on, she whispered. Nothing. She placed her hands on either side of the heart and began manual compressions. Slow, steady, rhythmic. 30 seconds, a minute. Reese stepped closer. Lindgren, not yet. 2 minutes. The heart twitched again, then contracted. Weak, but there. We've got a rhythm, Booker said. Lindgren kept compressing. The rhythm strengthened. The monitor beeped, faint at first, then louder. Pulses back, Navarro said. Pressure's climbing. 60/40, 70/50. She kept going. 80/60, 90/60. He's stable. She stepped back, hands shaking now, just slightly. She pulled them into fists. Navarro stared at her. How did you know that would work? Kandahar. We didn't have advanced cardiac support. We had ice and time. So we learned. Reese walked over slowly. He looked at Briggs, then at Lindgren. That was a field protocol, not standard care. It worked, this time. She pulled off her gloves. It worked every time I did it. 17 patients, all survived. Reese was quiet for a long moment. Why didn't you put that in your report? Because my CO buried it. Said it was reckless. Said I got lucky. Said if I ever did it again, I'd lose my license. And you did it again anyway. Because he was 29 years old and he wasn't going to die on my table. Reese looked at her, something shifting in his expression. Then he nodded, once. We'll talk about this later. He walked out. Lindgren stood there, breathing hard, staring at the monitor. The steady beep of Briggs's heartbeat filled the tent. Navarro touched her shoulder. Ma'am, that was the most insane thing I've ever seen. She almost smiled. Yeah, where did you really learn that? She looked at him. You want the truth? Always. Kandahar, 2010. We had a mass casualty event. 15 Marines. No blood, no evac, no backup. We did what we had to. I lost 3. Saved 12. One of them was a kid, 19. Fragment in his heart, just like Briggs. I dropped his temp, pulled the fragment, brought him back. My CO said I violated protocol. Said I should have let him go. What happened to the CO? She met his eyes. He got promoted. I got reprimanded. Navarro shook his head. That's messed up. Yeah, it is. Briggs stirred on the table. His eyes fluttered open, unfocused. Lindgren moved to his side. Lieutenant, can you hear me? He blinked. Tried to speak. His voice was barely there. Where? You're at the FST. You had surgery. You're stable. What happened? IED. Shrapnel to the heart. We removed it. You're going to be okay. He closed his eyes. Okay. She checked his vitals one more time. Steady, strong. Navarro was cleaning up the instruments. Ma'am, Reese is going to have questions. Let him. You just disobeyed a direct order. Again. I know. He could court-martial you. She looked at Briggs, still unconscious but alive. Then, it'll be worth it. Navarro smiled. You're kind of a badass, you know that? She almost laughed. Don't spread that around. Too late. She walked out of the tent, into the heat. The sun was high now, brutal and unrelenting. She pulled off her cap, ran a hand through her hair. Reese was standing near the HESCO barrier again, smoking. She walked over. You wanted to talk? He took a drag, exhaled slowly. I read your file again. After Kandahar. All of it. And? You saved 17 lives with that protocol. 17. And your CO buried it because it wasn't by the book. She didn't respond. Reese flicked ash onto the ground. I was wrong about you. She looked at him. Sir, you're not reckless. You're just willing to do what no one else will. Is that a compliment? He almost smiled. Don't push it. He dropped the cigarette, crushed it. Briggs is stable. You did good work in there. Thank you. But if you ever disobey me again, I will court-martial you. Understood. He walked away. Lindgren stood there, staring out at the city. The smoke was thinner today, almost peaceful. Navarro appeared beside her. So, what now? She shrugged. We wait for the next one. Think Reese will let you operate again? She smiled faintly. Guess we'll find out. Navarro handed her a canteen. For what it's worth, ma'am, I'd follow you into any OR. She took it. Appreciate that, Navarro. They stood there in silence, watching the horizon. Somewhere in the distance, a helicopter lifted off, and the war went on. Lieutenant Briggs woke fully the next morning. His vitals were strong, pulse steady, oxygen saturation normal, color returning to his face. He tried to sit up, winced, and Lindgren was there, hand on his shoulder. Stay down. You had open chest surgery 12 hours ago. You're not going anywhere. He looked at her, eyes clearer now. You're the one who did it. I am. They said I was dead. You were, briefly. He exhaled slowly, staring at the ceiling. How? Hypothermia protocol. Dropped your core temperature, removed the fragment from your heart, brought you back. That's not standard procedure. No, it's not. He turned his head to look at her. Why'd you do it? Because you weren't done yet. He smiled faintly. Thank you. She nodded. Rest. You've got a long recovery ahead. She walked out, but she felt his eyes on her back. Reese was waiting outside, clipboard in hand. He fell into step beside her. Briggs is stable. I'm recommending him for evac to Landstuhl in 48 hours. Good. Reese stopped walking. We need to talk. My office. Now. She followed him to the small Connex container he used as an office. Barely room for a desk and 2 chairs. He closed the door, gestured for her to sit. She did. He sat across from her, hands folded on the desk. I've been going through your records. All of them. Not just the official file. I made some calls. To who? People who were in Kandahar with you. Corpsmen, nurses, other surgeons. And? He leaned back. They all say the same thing. You're the best trauma surgeon they've ever seen. Fast, precise, calm under fire. But they also say you don't follow orders. That you improvise. That you take risks no one else would take. That's accurate. Reese rubbed his jaw. They also told me about Corporal Jensen, the unauthorized transfusion. She didn't respond. Your CO, Lieutenant Colonel Hastings, wrote you up for it. Said you endangered yourself and the patient. Said it was reckless and unacceptable. He pushed for a dishonorable discharge. I know. But you weren't discharged. Why? Because Jensen lived, and because 3 other officers vouched for me. Said I saved his life. Said Hastings was covering his own ass because we ran out of blood on his watch. Reese nodded slowly. Hastings is now a full colonel. Pentagon assignment. Good for him. He buried your technique. The hypothermia protocol. The field transfusion method. All of it. Marked it as experimental and unauthorized. She met his eyes. I know that too. Why didn't you fight it? Because fighting it would have meant a court-martial. And I wanted to keep doing my job. Reese was quiet for a moment. Then he opened a folder, slid a paper across the desk. This is a testimony from Staff Sergeant Raymond Dawson. He was in Kandahar, witnessed the Jensen transfusion. She looked at the paper, but didn't pick it up. Reese continued. Dawson says Hastings ordered the supply convoy rerouted to avoid an IED threat. That reroute delayed blood resupply by 6 hours. Jensen would have died waiting. You saved him with your own blood because there was no other option. Dawson says Hastings blamed you to cover up his own mistake. She still didn't respond. Is that true? Yes. Why didn't you say anything? Because it wouldn't have mattered. Hastings had rank. I didn't. And I was already on thin ice. Reese closed the folder. You've been carrying that for 2 years. Longer. He stood, walked to the small window, looked out at the base. I owe you an apology. She looked up. Sir, I called you reckless. I called you a liability. I was wrong. You were doing your job. No, I was protecting my career. Same as Hastings. She didn't argue. He turned to face her. What you did yesterday, with Briggs, that should be standard protocol. It should be taught. It should be in every field manual. It's not. It should be. She stood. Is that all, sir? No. He walked back to the desk, pulled out another paper. I'm recommending you for the Navy Commendation Medal, for actions in Kandahar, and here in Fallujah. She stared at him. Sir, I don't need. It's not about what you need. It's about what's right. She didn't know what to say. Reese handed her the paper. And I'm also recommending you for lead trauma surgeon at this FST, effective immediately. She took the paper, read it, looked up. What about Booker? Booker's good. You're better. Sir, I appreciate this, but it's not a request, Lieutenant Commander. It's an assignment. She held his gaze. Understood. Good. Dismissed. She walked out, still holding the paper. Navarro was waiting outside. He saw the look on her face. What happened? She handed him the paper. He read it, eyes widening. Holy shit. Lead surgeon? Apparently. Ma'am, that's huge. She shrugged. It's just a title. It's not just a title. It's recognition. She looked at him. Navarro, I didn't do any of this for recognition. I know. That's why you deserve it. She almost smiled. Thanks. He handed the paper back. So what now? Now we get back to work. They walked toward the surgical tent. Halfway there, the alarm sounded. Incoming wounded. Sniper attack on checkpoint Vera. 3 casualties. 2 critical. ETA 6 minutes. Lindgren broke into a run. Navarro right behind her. The tent filled fast. She gloved up. Didn't wait for orders. The first patient came in. Marine. Mid-20s. Gunshot wound to the chest. Right lung collapsed. She placed a chest tube, reinflated the lung, stabilized him in 9 minutes. Second patient. Gunshot wound to the abdomen. She opened him. Found a liver laceration and a nicked renal artery. She repaired both, closed in 18 minutes. Third patient. Head wound, superficial. She debrided, sutured, sent him to observation. When she stepped back, Reese was watching from across the tent. He nodded once. She nodded back. Booker approached, pulling off his gloves. Congratulations, by the way. For what? Lead surgeon, Reese told us. She looked at him. You okay with that? He smiled. Are you kidding? I'm relieved. That job's a nightmare. She almost laughed. He clapped her on the shoulder. Seriously, though, you earned it. Thanks. He walked away. Hayes came over next, shook her hand. Well-deserved, ma'am. Appreciate it. One by one, the team came by. Quiet congratulations, nods of respect. Navarro was the last. He handed her a canteen. Told you. Told me what? That you're a badass. She took the canteen. Don't start. Too late. You're officially a legend now. She drank, handed it back. Legends don't exist. Just people who do their jobs. He grinned. Keep telling yourself that, ma'am. She walked outside. The sun was setting now, the sky turning orange and purple. The heat was finally breaking. She stood there, alone, staring at the horizon. For the first time in 2 years, she felt something she hadn't felt since Kandahar. Not pride, not relief, just peace. She thought about Jensen, about Briggs, about all the others. She thought about Hastings, sitting in his Pentagon office, probably never thinking about her again. And she realized something. She didn't need his approval. She didn't need anyone's approval. She just needed to keep doing what she was made to do. Save lives, one at a time, no matter what it cost. She turned and walked back inside. There was always another patient, always another fight, and she wasn't done yet. 2 weeks passed. The rhythm of Fallujah continued. Mortars at dawn, Patrols during the day, casualties at night. Lindgren ran the surgical team with quiet efficiency. No speeches, no grandstanding, just competence. The mortality rate dropped. Word spread. Marines started asking for her by name. Get me to Lindgren. Where's the doc who brought Brace back? I want the blonde surgeon. The one who doesn't quit. Reese noticed. So did everyone else. On a Tuesday morning, he called her to his office again. She walked in, expecting another taste review. Instead, there was someone else there. A Navy captain, 50s, silver hair, sharp eyes, name tape read Dalton. Reese gestured to a chair. Lieutenant Commander Lindgren, this is Captain Dalton. He's here from BUMED, Bureau of Medicine and Surgery. Lindgren sat. Sir, Dalton nodded. Commander Reese has been sending me reports. Very impressive reports. Thank you, sir. He opened a folder. 17 successful hypothermia resuscitations. Lowest surgical mortality rate in theater. Multiple commendations from field commanders. He looked up. You've made quite an impression. I'm just doing my job, sir. Dalton smiled faintly. That's what everyone keeps saying about you. He closed the folder. I'm here to offer you a position. Sir? We're developing a new combat trauma training program. Advanced field protocols for extreme situations. We want you to lead it. She blinked. Lead it? Design the curriculum. Train the next generation of combat surgeons. Your techniques. Your protocols. Everything you've learned. We want it standardized and taught across all branches. Lindgren looked at Reese. He was watching her, expression unreadable. She turned back to Dalton. Sir, I appreciate the offer, but I'm not a teacher. I'm a surgeon. You'd still operate, but you'd also teach, and your work would save exponentially more lives. I'm needed here. Dalton leaned forward. Commander, you've proven yourself, multiple times over. But staying in a field hospital isn't the best use of your skills. You could shape the future of combat medicine. She was quiet for a moment. When would this start? 6 months. You'd finish your deployment here, then rotate stateside. Bethesda Naval Hospital. Full surgical staff, state-of-the-art facility, and a team of instructors waiting for your input. What about my record? Kandahar? Dalton's expression shifted. That's been reviewed, extensively. And? He pulled out another document. Staff Sergeant Dawson provided a full deposition. So did 3 other witnesses. Lieutenant Colonel Hastings' report has been reassessed. Overturned. Your actions in Kandahar have been officially recognized as life-saving field innovation under extreme duress. The reprimand has been expunged from your record. She stared at him. Expunged? Completely. Hastings, on the other hand, is under investigation for negligence and falsification of reports. She didn't know what to say. Dalton continued. You were right, Commander, and you were punished for it. That ends now. Reese spoke for the first time. You deserve this, Lindgren. She looked at him. Sir, I didn't ask for this. I know. That's why you're getting it. Dalton stood. You don't have to decide right now. Think about it. Talk to your team. But I need an answer in 72 hours. Yes, sir. He shook her hand. Whatever you decide, Commander. Thank you for your service. You've already done more than most will do in a lifetime. He left. Reese stayed. Lindgren sat there, staring at the folder on the desk. You should take it, Reese said quietly. She looked up. Why? Because you've proven everything you need to prove here. And because what you know shouldn't die with you in a tent in Fallujah. She didn't respond. He leaned back. When I first met you, I thought you were a cowboy. Someone who couldn't follow orders. Someone dangerous. She almost smiled. And now? Now I think you're someone who sees what needs to be done and does it, regardless of the cost. And that's exactly what the Navy needs. She exhaled slowly. I don't know if I can do it. Teaching. I've never been good at that. You taught Navarro. You taught Booker. You taught all of us. Whether you meant to or not. She looked at him. What if I say no? Then you stay here, and you keep saving lives one at a time. And that's enough. But it's not everything you could do. She stood. I need to think. Take your time. She walked out. That night she found Navarro outside the med tent, cleaning instruments under a floodlight. He looked up. Ma'am, everything okay? She sat down on a crate beside him. Navarro, can I ask you something? Always. If you had a chance to leave here, to go teach, to pass on what you know, would you take it? He set down the forceps. Is that what this is about? The Navy captain? Word travels fast. He smiled. It always does. He was quiet for a moment. Honestly, yeah, I'd take it. Because what I know, I learned from people who didn't make it home. And if I don't pass it on, They died for nothing. She nodded slowly. But, he added, that's me. You're different. How? You're not done here yet. She looked at him. What makes you say that? Because you don't do this for recognition. You do it because you can't not do it. And that's not something you can teach. Maybe. He picked up the forceps again. For what it's worth, ma'am, whatever you decide, you've already changed everything here. We're better because of you. All of us. She stood. Thanks, Navarro. Anytime. She walked across the base, past the sleeping tents, past the motor pool, to the edge of the perimeter. The city was dark, quiet for once. No mortars, no gunfire, just silence. She thought about Kandahar, about Jensen, about Briggs, about all the others whose names she barely remembered, but whose faces she'd never forget. She thought about Hastings and the weight she'd carried for 2 years, and the fact that it was finally gone. She thought about teaching, about standing in front of a classroom, about watching young surgeons learn what she'd learned in blood and dust and desperation. And she realized something. She didn't want to leave. But she had to, because Navarro was right. What she knew couldn't die in a tent in Fallujah. She walked back to Reese's office. He was still there, working under a desk lamp. He looked up. That was fast. She stood in the doorway. I'll take it, on one condition. Name it. I finish my deployment here. All of it. No early rotation. Dalton's not going to like that. I don't care. If I leave early, it sends the wrong message, that teaching is more important than the mission. And it's not. Reese studied her. You're sure? She nodded. I'm sure. He smiled. All right. I'll tell him. Thank you, sir. She turned to leave, but he stopped her. Lindgren. Sir? You're going to be a hell of a teacher. She almost smiled. Let's hope so. She walked out into the night. Somewhere in the distance, a helicopter took off. And for the first time in years, she felt something she hadn't felt since medical school. Hope. Not for herself, for everyone who came after. 6 months later, Lindgren stood in a lecture hall at Bethesda Naval Hospital. 52 students sat in tiered rows, surgical residents, Navy corpsmen, a few Marine medics. All of them younger than she'd been in Kandahar. All of them watching her with a mixture of curiosity and skepticism. She was 52 now. Hair still blonde, but with threads of gray she didn't bother to hide. Same pale blue eyes. Same quiet intensity. She wore her uniform. Lieutenant Commander insignia on her collar. Ribbons across her chest. Navy. Avi Commendation Medal among them. She stood at the podium looking out at the faces. For a moment she didn't speak, just let the silence settle. Then she began. In Fallujah, November 2004, a Marine named Lieutenant Briggs came into my surgical tent with a piece of shrapnel embedded in his heart. He'd been clinically dead for 6 minutes. No pulse, no pressure. Pupils fixed. Everyone said he was gone. She clicked a remote. A slide appeared behind her. A photo of Briggs. Smiling, in dress uniform. I brought him back using a field protocol that wasn't in any manual. It wasn't approved. It wasn't standard. But it worked. And that's what we're going to talk about today. A hand went up. A young resident, maybe 27. Lieutenant, why wasn't it in the manual if it worked? Good question. Because the person who could have put it there decided it was too risky, decided I was reckless, decided it was better to let people die by the book than live outside of it. The room went quiet. She advanced the slide. A chart appeared. Survival rates. Kandahar, Fallujah, before and after the hypothermia protocol. 17 patients. All survived. 0 complications. And for 2 years, that protocol didn't exist officially, because someone with more rank than me said it shouldn't. Another hand. A corpsman, older, maybe 35. What changed? Witnesses came forward, testified. The record was corrected, and now we're here. She moved away from the podium, closer to the students. That's lesson 1. Just because something isn't in the manual doesn't mean it's wrong. And just because someone with rank says no, doesn't mean they're right. Your job is to save lives, not to protect careers. She let that sit. Over the next 6 months, you're going to learn techniques that didn't exist 5 years ago. Sealed hypothermia, damage control resuscitation, whole blood transfusion under fire. All of it came from people like you, in places like Kandahar and Fallujah. who refused to accept that dead meant dead. She clicked again. Photos of field hospitals. Dust, blood, chaos. Some of you will deploy, some of you won't. But all of you will face a moment where the patient is dying and the book says there's nothing left to do. And in that moment, you'll have a choice. Follow the book, or follow your training. She looked at each of them. I'm here to make sure you have the training. The lecture continued. 2 hours. Technical, detailed. She walked them through the Briggs case step by step. Incision, hypothermia induction, fragment removal, cardiac repair, rewarming, resuscitation. Questions came fast. She answered every one. When the session ended, a few students lingered. One of them, a young woman, maybe 26, approached hesitantly. Ma'am, can I ask you something? Go ahead. The student hesitated. I'm prior enlisted. Army medic. Did 2 tours in Afghanistan. I saw things I couldn't fix. Lost people I should have saved. And I'm terrified I'm going to freeze when it matters. Lindgren studied her. What's your name? Corporal Delgado. Well, former corporal. Just Delgado now. Lindgren nodded. Delgado, the fact that you're terrified means you care. And that's more important than anything I can teach you. But what if I'm not good enough? You already were good enough. That's why you're here. Delgado's eyes welled up. She blinked it back. Thank you, ma'am. Come see me after class tomorrow. We'll talk more. Yes, ma'am. She left. Lindgren gathered her notes, shut down the projector. A voice behind her, still making. GAN impact, I see. She turned. Commander Reese, now Captain Reese, promoted 6 months ago. He walked down the aisle, hands in his pockets. Jack, what are you doing here? Visiting. Heard you were teaching. Wanted to see it for myself. And? He smiled. You're better at it than you thought you'd be. She almost laughed. High praise. He reached the front row, leaned against a desk. How's it going? Really? She set her notes down. It's strange, being here, not in the field. You miss it. Every day. But I see these kids, and I remember being that age. Thinking I knew everything. Then getting to Kandahar and realizing I knew nothing. And now you're the one teaching them what you learned. She nodded. Yeah. Feels full circle. Reese pulled an envelope from his jacket. Speaking of full circle. What's that? Letter, from Briggs. She took it, opened it. A handwritten note. Neat script. Commander Lindgren, I'm getting married next month. I wouldn't be here without you. My fiancé wouldn't have me. My future kids wouldn't exist. I know you don't like being called a hero, but that's what you are. Thank you for refusing to quit. Semper Fi, Lieutenant Michael Briggs, USMC. She read it twice, folded it carefully, slipped it into her pocket. Reese watched her. You okay? She nodded. Yeah, it's a lot sometimes. I know. They stood there in silence for a moment. So, Reese said, what's next for you? She looked at him. What do you mean? I mean after this. After the training program. BUMED's already talking about expanding it, making it joint service. They want you to lead that too. She smiled faintly. One thing at a time. Fair enough. He pushed off the desk. For what it's worth, Sarah, I'm proud of you. She met his eyes. Thanks, Jack. That means a lot. He nodded. I'll let you get back to it. He left. She stood there alone in the empty lecture hall. The lights hummed overhead. Outside, the sun was setting. She thought about Fallujah, about Kandahar, about all the tents and the dust and the blood. She thought about Jensen and Briggs and Sergeant Macklin and all the others. She thought about Delgado, terrified and determined and already better than she knew. And she realized something. This was where she was supposed to be, not in a tent in a war zone. Here, teaching, passing it on, because the war would always be there, but the people who fought it needed to be ready. And that was her job now. She picked up her notes, turned off the lights, and walked out. Down the hall, she passed a bulletin board. Flyers for lectures, research opportunities, deployment notices. One caught her eye. Volunteer Trauma Surgery Mission, Sub-Saharan Africa. 6 months. High risk, high impact. She stopped, read it again. Then she smiled, because some things never changed. She pulled out her phone, dialed a number. Captain Dalton answered. Commander Lindgren, what can I do for you? Sir, I saw a posting. Volunteer mission, Africa. I saw that too. You interested? She looked at the flyer again. Maybe. After the training program wraps. Dalton chuckled. You can't stay still, can you? No, sir, I really can't. All right, I'll put your name in. Thank you, sir. She hung up. kept walking. Somewhere ahead, a new class was starting. Somewhere behind, an old war was ending. But the work was never finished. And Sarah Lindgren wasn't done yet. Not by a long shot. She pushed open the door to the next lecture hall. 50 more faces looked up at her. She smiled. "All right," she said. "Let's get started." And she did.